Two patients, same disease, but underwent two complete different surgery. One walks out with a tiny scar, while the other has a massive incision across the abdomen. So, what's really the difference between laparoscopic surgery versus open surgery? Okay. And laparoscopic surgery, doctors don't fully open your body. Instead, they make a tiny cuts, insert a camera, and operate while watching on a screen. Open surgery is completely different. One large incision, direct access with the surgeon on the hand, no camera tricks, no tiny instrument. And in massive trauma, severe bleeding, or a giant tumor, the direct access can make the difference between life and death. Now, here's where it gets interesting pain. And laparoscopic surgery usually causes less pain afterward. Why? Because tiny cuts damage less muscles and tissues. While open surgery, it has a bigger wound, more tissue trauma, and usually more pain after the surgery. Patient with laparoscopic surgery recover faster than the patient with open surgery. Some people walk on the same day, while some people go home within 24 hours. While open surgery can take weeks, sometimes months. Let's talk about the scar. Laparoscopic surgeries leave a tiny scar that can almost disappear. Open surgery leave a much larger visible scar, but here is the twist. The bigger the scar sometimes means that the surgeon had better access to save the patients. While laparoscopic surgery is often more expensive than the open surgery because it needs specialized camera, advanced instrument, expensive operating equipments, and highly trained surgical team. Open surgery is usually cheaper, available in many hospitals because the equipment is simpler. But if laparoscopic surgery shorten the hospital stay and recovery time, total cost can sometimes become lower than the open surgery. As laparoscopic surgery has smaller wound usually mean low infection risk, less blood loss, and shorter hospital stay. But laparoscopic surgery is not always safer. Imagine this. So, a patient arrives after a major car accident, internal bleeding everywhere, every second matter. Doctor may instantly choose open surgery because they need full visibility and immediate control of the bleeding. So laparoscopic surgery is mainly used for gallbladder removal surgery, appendix hernia repair, bariatric or a weight loss surgery, gynecological surgery, and some colon surgery. But common open surgeries are major trauma surgery, emergency abdominal bleeding, larger or a tumor removal, sometimes heart surgery, organ transplant, and complex bowel surgery. And the biggest misconception online is people hear that minimally invasive surgery and think that it's a minor surgery. Absolutely not. Even laparoscopic surgery can involve general anesthesia, major organ operation, serious complication if delayed. So which one is better? The answer is neither. The best surgery is the one that gives the patient the highest chance of survival and faster recovery. Tiny cuts looks impressive, but in medicine, the goal is never smaller scar. The goal is saving lives.